Okay, now today we have a guest from Lithuania. Lithuania is a country uh, which is within the Nordic region, and it's a small country. Um and we have Natalja from Lithuania, who is presently Professor and Director, Institute of Health Science, Medical Faculty of Vilnius University. And she was formerly Vice Minister of Education and Science Ministry of Lithuania. And we are happy to have you in this evening for this very important discussion.
Yeah. Hello.
Yeah.
Nice to be here also. Thank you.
Yeah. So starting with Lithuania, if we look at the number of COVID cases, Lithuania is still behind 2000. You are not even number 2000. And the deaths are also very less. And you have nearly 2.7 million population, which is somewhat half of the Finland population. And one interesting thing I have noticed is you have done much more tests. Probably you are the leader in the test within the Nordic area. Much more, almost 130,000 tests you have done. So my first question to you is, what do you feel about, your neighbors across the Europe? There are a lot of cases increasing very spontaneously, like Italy, France, Germany, all these countries. So what do you think about, what was the advantage that Lithuania had in terms of coming down with this small number?
Okay, thank you for questions, Tom. I think the most important thing that Lithuanian government has done, quite early we had the quarantine in our country. So the quarantine was, we had from March, the beginning of March, then still we had only few cases registered of COVID-19. And we started quite early. So all schools were closed, all schools worked as a distance level, and many we had a quite clear recommendation how to go outside, but at the same time we did not had very strict requirements. So people were quite free to go outside without any limitation to time, but I think it was clear recommendation of what we should do. And the first and very important recommendation was quite simple, to wash hands. So our people started probably to wash hands more often than it was before, and to stay home. So it's in the whole world, these two words, stay at home. I think it was very beneficial for our population. So the distance between people, washing hands, and we have masks. So we all have a lot of masks. So now I also have, only for this interview we are without mask. And so we had quite clear prognosis. So in the beginning of March, we just know that we will have the biggest numbers in the end of April. So in our medical society, those prognoses were clear, and it was like this. So now we have we finish announcement of finishing of quarantine in June 17. So, but now just last day we had more than before cases during the day. So 19 cases we had yesterday, and probably it's because the people more relaxed. So
okay. How did the people perceive when all these restrictions? Because it is, in fact, European community is more free, freedom-loving community. So once you put all these restrictions, how the population perceived it? Was there any problem from the population
No,
side?
I think that of course some people were not satisfied with so many restrictions. So, but I think our society also had many positive things in this quarantine, like to spend more time with family, to spend more time with children,
Okay,
and of course there are some psycho-emotional problems, and we had more depression in some population.
okay,
But in generally, the also I just wanted to say that we had very few cases of infection in other diseases,
okay.
like other infectional virus, so
You don't. Okay,
transmitted diseases. So we had very few numbers.
okay. So that could be one of the reason for you want to say that the less number of other infections could be a reason for you were able to fight COVID better. Is that you wanted to say?
I think that all things like masks, hand washing, and social distance.
Okay,
So these three things, they were mostly beneficial for not only for COVID-19 but also for other infectional diseases.
okay,
Then people are very close each to other.
okay.
It's more how to say, more dangerous for people. In Lithuania, as you said before, we are quite small country,
Yeah,
and we have a big area. Big area. There's not many people, so we have a lot of space between us,
okay,
and it is possible to be quite not too close each to other. So we can be in the buses and have 2 meters between us. We
okay,
can be in some other places and have quite big distance. And of course, we did not have any events. Any
okay,
events in
okay,
the whole country, no conferences, no seminars, no lectures, no any other events. Only people can be together. If it's family, it could be 4 and 5 people. But if you are not family, you cannot go together to be. So you need to be separate.
okay,
Probably this quite strict requirements were useful for us.
okay. And once a person is uh, showing symptoms, so what was the procedure? Because in India, it's a long procedure. Immediately, sometimes people have to immediately report to the hospital. How did you manage? Like suppose at my home somebody is showing COVID symptoms. So then what happens?
So if we are speaking about symptoms
Yeah, yeah, yeah.
of who has COVID-19,
Mm.
it is also another point. So we had quite big numbers just without symptoms, because the testing was quite often. And for example, in our hospitals, all staff has testing every week, and very big part of our people, they had COVID-19 without any symptoms. So we had very few difficult cases,
Okay.
very serious cases. They had only very few, and all our deaths from COVID-19 not was only from because of COVID-19. Usually there were quite old people, 80 years plus,
Hmm.
very few who was only 60,
Okay.
61.
Okay.
So usually it was not because of COVID, but also plus other chronic diseases. and
Okay.
not one chronic diseases. Usually it's hypertension, it's diabetes mellitus, and other chronic diseases.
Okay. So it means once a person is diagnosed of COVID, so you tell them to go to hospital or go back to home.
No, if they have no symptoms, they can stay at home or stay in other places for 2 weeks, and the person should have twice negative test.
Okay.
After it was quite, yes, probably also I need to say about this. It's like isolation, self-isolation. It was very, very popular, and all people who come from abroad, they should be self-isolated for 2 weeks, and the municipalities paid for staying at hotels or in other places for self-isolation.
Is it
So
free?
people,
If
yes, it was free. It was
municipality.
free. Yes, it's free. It was paid by municipality, and in some municipalities nutrition was free, but in all municipalities accommodation and breakfast was free for those people, as well as all transportation inside country. So, for
Okay.
example, if you come to Vilnius airport and you should go to Klaipėda, it means 300 kilometers. So you get free bus, which go. And if you have at home, if you are only alone at home, you can have your self-isolation at home. But if you have family who need to stay at home, so you stay at the hotel for 2 weeks. This breakfast, lunch, and some other places, and only if you have negative test, you can go to your family and stay with them.
Even
So I think
hotel.
it also was.
Yeah. Even hotel bills are also paid by the municipality, right?
Yes.
Everything.
Yes.
Okay. And what do you think? Because nearby countries like Sweden, Finland did not, particularly Finland, you are very close to Finland. So Finland
Yes.
did not have that much large numbers of infection. If you look at from the beginning, say from March. So what motivated you to do so many tests? Like you did one of the highest number of tests within the Nordic region. So any special reason why you did so many tests, or can you relate the test with your success in terms of reducing the number of infections?
I think it is important to test as much as possible, because
Okay.
you need to know the real situation. For example, if we look to the situation of Brazil, in Brazil, I just checked before some hours, from 1,300,000
Yeah, yeah,
tests,
yeah,
they have positive age 800,000
yeah,
cases.
yeah.
So it means that almost all population in Brazil now infected. So in Lithuania, I hope we also have more infected people, but the situation, like we have quite easy cases without any symptoms, or very, very few symptoms which are not dangerous for health.
Okay.
So that's also one of the point, I think, that we have not very serious cases.
Okay.
But in our country, mostly infected people who came from abroad, and medical staff who are working at the hospital. So this
Okay.
is
Okay.
the mostly infected people.
Okay. So medical staff and the people who came
Yes.
from other countries. Okay.
Yes.
And how do you see ahead? Because in our place there are a lot of people who are losing jobs, lot of enterprises shutting down. The economy is affected very badly. So how do you see in Lithuania how the employment, economy, education, these sectors have been affected because of COVID? And how do what kind of mechanisms that you have in place to help those people, like those who have lost job, those who have lost their work, those industries which are shutting down. So what do you think? What kind of measures that the government has taken?
Mhm. Yes, I want to say that many people just also had their work during quarantine, who are not working. These people in big amount. So if you're, for example, if you're working at the university or at school, all people just continue their work via computers through all
Yeah, work from
devices.
home. Work from
But
home.
of course, we have a problem with those who are working, for example, in small business, uh, like all, for example, um, all services were closed during this, and the government has decision to help those people. So all who worked in small and medium business, they all get financial support from government for all 3 months. And now they can also apply for support, as well as parents who have children, they get additional support. If you have children till 11 age, you can stay at home with your children and just to have your salary from
Okay.
government. And now we have also additional budget from our government for helping in health for people who suffer from the quarantine during those months, and who lost their job. They all have full how to say full financial support during those 3 months. So, but now they can again to have a job and to continue in the old places.
Okay. And how, just to know, how the, suppose somebody is in quarantine, how the neighbors see them, whether they see them with fear or whether they see them with care. How the neighboring community, suppose in a community, two families are in
Mhm.
quarantine. So how the neighbors see them?
How many neighbors?
No,
Sorry.
no, no. My question is how the neighbors, people living nearby the quarantine home, or people who are infected. So how the community see them? Whether they see them something like with lot of fear.
No, I think we had the support and help from neighbors. So all young neighbors just left their food for older neighbors who cannot go out from the houses, from the apartments. And also municipality had, we had very strong people who are self-helpers. So
Okay.
they can register in some databases and to go to help others. So
Okay.
it was I think good system, and they didn't have fear of infection. So we just know that this infection, it's normal, and probably we stay with this infection for many years. So we just need to know how to live with it. So
Yeah.
probably the first 2 weeks of quarantine were like it's something for fun to stay at home, but after
Okay.
that people just understand that it's for a long time, and we need to live, just to live, to stay this virus, to stay with COVID-19, but no fear, no panic. Probably firstly it was not serious, but now they know that it is serious, but without panic.
I think that's a good feel, because many countries see this as a lot of fear. If an infected person coming, or if a quarantine people coming, traveling from an infected area, a lot of fear is generated within the community. And the last question I have is, in the entire COVID management, we could see that you did more of this is more of a social uh, interventions, like for example, social distancing, quarantine, isolation. These are all not any medical intervention. So, what do you see like in the days to come? Like we have already said, it will probably last for many more years. We don't know. So, what do you think the health system or the healthcare machineries, because this disease have very less role to play. The health system has only very limited role to play in terms of monitoring and supervision, but rest of the thing the community has to do. So how the government is going to take this up, because this is going to be last for probably for another 2 years, 3 years, we don't know. So what do you think, what will be the role of the government, what will be the role of the health system to face this?
Yes, I think this pandemic situation show us also the crisis of healthcare system. Then we all know from WHO that only 10% of our health depends on healthcare system, and 50% depends on our healthy lifestyle. And in this case, of course, we just needed to evaluate again, to investigate again our healthcare system resources, like human resources, like other resources which we have in healthcare and at hospitals and in primary healthcare and so on. And now I think we oriented to strong our system more, and probably we need more employees in our healthcare systems. So also government that is support the public health specialists. So in Lithuania, we have personal healthcare and public healthcare. And this public healthcare probably was not very serious. Like people just thought that mostly important to go to the hospital, to polyclinics, to meet doctor, to meet nurse, and this is the best situation. Now then our primary healthcare centers were closed for people, so we only had discussion through phone and consultation through phone, and all planned operation surgery were also closed, or just we had only emergency service at hospitals.
Okay.
It show for people that they can live without doctors and nurses for some period. Probably not necessary to go to the hospital in all cases, but of course now we have very similar numbers of patients at our hospitals like we had before quarantine. But I think it's very good for people understanding that their health depends on their own decisions, not on the healthcare system. In any cases, now we know, and people know, that personal healthcare specialists like doctors and nurses and public health specialists, they are both very, very important for our health.
Yeah, I think that is a very good end message, because healthcare globally now taking a shift to more into the public health, and the individual responsibility of being healthy is disseminated naturally. It's a natural dissemination, not like somebody educating someone else, but it's a natural dissemination which is going across the world, saying that you are responsible for your health and you should be one of the main stakeholders in the entire healthcare scenario. And to be good health doesn't mean that hospitals and dispensaries and health centers, but more about the practices, the beliefs, the way you behave, the way you consider health situations. So I think that's a very good outcome and very good probably in the days to come, it will be more strengthened. And one very important thing is the public health is getting more and more importance, like you said. And let's hope that in the days to come, all countries will be able to come out of this very soon. And let's hope that COVID will be ended very soon. And thank you very much for joining us. And I wish all the best for all the efforts you are doing in Lithuania. And thank you.
Thank you very much,
Thank you.
Tom, for this possibility to talk with you, to share our experience from Lithuania. So I hope meet you soon in India.
Yeah, sure, definitely.
Yeah. So and good luck for India. Thank you for your job you're doing there.
Okay. Okay. Thank you very much.
Thank you.